United States Surgeon General says there's a health risk that you may be dealing with right now that's just as deadly as smoking up to 15 cigarettes a day and increases the risk of premature death by almost 30%. That health risk is loneliness, and the Surgeon General says it's a public health epidemic.
This is an area of real concern, if we're thinking about physical and mental health.
This 82-page advisory was just released this week, and it found loneliness is surprisingly common in this country. 1 in 2 American adults say they have experienced some degree of loneliness, and young people experience loneliness at a much higher rate than the general population. The pandemic, of course, made things worse. Between 2003 and 2020, social isolation spiked not just among friend groups and communities, but also loneliness within your own household.
You might think, well, why does this really matter? Isn't it just a bad feeling? Well, that's where it becomes really concerning, because loneliness and isolation are more than just perhaps temporary states or bad feelings. But we know that when people are socially disconnected, that increases their risk of depression and anxiety and suicide. But it also increases their risk of physical illness like heart disease and stroke and dementia.
So how do we fix this? The Surgeon General suggests a 6-pillar approach, including things like establishing community connection programs, training healthcare workers to recognize the signs of loneliness, and reforming the digital environment by establishing tech safety standards and requiring better data transparency. The Surgeon General says if your device displaces in-person engagement, monopolizes your attention, reduces the quality of your interactions, or even diminishes your own self-esteem, you should probably rethink the amount of time you're using it. Now, if you want to read the full report, I will email it out in my NewsGirl News Roundup email.